Very simple. So, for the aging population, the idea of overall healthcare besides taking medication, is there a reality that you've seen that if someone is taking medications and they are on acupuncture treatment, have you seen any cases where people actually were able to lower the dosage of their medication, say for high blood pressure, for example, if they were getting acupuncture and treated for that, that it reversed it? Or have you seen anything like that?
Okay. What I tell patients is acupuncture enhances the medication you're taking if it's appropriate. So let's say you are on a pain medication over and over again. Let's say they're taking 6, 8 pain pills a day, and it's barely touching the problem.
Right.
After one or two, and all of a sudden it's working. Okay, 1 or 2 pain pills is having an effect that 6 or 8 didn't. So, and that goes with other medications as well. But when you're dealing with something like, let's say, cardiology or heart, these things have to dovetail into the physician and what the physician's recommending. If the people are noticing their blood pressure, as you mentioned, is normalizing or going down, okay, because acupuncture brings everything to the center. If you're hyperactive, it's going to bring it down to the center. If you're hypoactive, it's going to bring it back up. So as you begin to normalize in discussion with your prescriber, he or she may then say, okay, let's try a lower dose and see if we're getting the same result. So yes, we do work together with the medication and their physician.
In your 40 some years, what would you say was the single biggest success story that you had? You probably had a lot of them.
I should have been prepared for this one. I'd rather have some patience answer that question.
It doesn't have to be the most profound one, but the one that you remember, because I know I caught you off guard.
I remember a lot of them. I had a fellow who was he was working underneath his car in his garage, and he had the car on a jack, and he had a young fellow helping him, handing him tools. He was under the firewall on the back of his car, and he asked his assistant there to jack it up a little higher, and the kid accidentally let the car down on him. He was a big guy, but now he's bench pressing the firewall of the car off of him from crushing his body. He can't even yell, jack it up, because all his concentration is on keeping the car from crushing him. Okay. His blood vessels in his eyes popped. His eyes started bleeding, okay, from this pressure. The young man freaked out and started crying and didn't jack the car back up. Luckily, across the street just happened to see the car go down and slowly come up. And he thought, that's odd. He came across the street as a rescue and jacked the car and took it off of him. Well, this fellow came to me with searing intercostal pain, where the ribs from your spine that go around to the front, that's called the intercostal area. And there's all nerves in between those ribs, okay? A lot of people get shingles along that pathway of those nerves around the side of your body. And medical doctors, nobody could do anything. They could just try to numb it, okay? So with acupuncture, with very few points, just one above your wrist on the outside, one below his knee, one down near his foot, on the side of the body, we were able to, get complete relief of this. It got better in just a handful of treatments. It wasn't a long course of treatment. That just comes to mind because it was so dramatic, that particular one. You have a lot of people with different difficulties. Maybe they have Lou Gehrig's disease and they can't swallow or something like that. And you've been able to help them swallow and slow the progression of that disease. That's very, very important to somebody who's got a chronic degenerative problem like that. I had a couple bring a baby in who was starved for oxygen at birth with cerebral palsy. And this little girl was like a rag doll. Her head was just slumping down. And with the acupuncture treatment, she was able to hold her head erect. Didn't cure the cerebral palsy. She would have years of, all the therapy that, a couple could afford, I'm sure. But just that, to be able to hold their head erect, was terrific, for the
Absolutely.
parents. And,
Absolutely.
I have a young guy as a patient. He's like 11 years old, and he had a bad reaction as a child to immunizations where it caused his bowels to bleed and have constant diarrhea. And many different medications they've tried experimentally on him. The mother having to narrow his diet. Excuse me.
I
Are
just
you
lost.
still there?
Yeah, there we go. You're back. You're back, bud.
The mother having to narrow his diet down to very few foods. The bowel has cleared up, no more blood. He can have a wider berth of foods he can tolerate and eat right now. All of those things are, they all have their own merit and they all stick out individually, to answer your question.
Excellent. Excellent. It's wonderful to hear that. So I just that just came to my mind to ask you that question. So I appreciate you doing that off guard. So just one more time, just repeat how to contact you again, pal.
Acupuncture-practice.com. Just Google Robert Lenahan, Lenahan, and it'll come up acupuncturist. You should be able to find me pretty easily that way. And the phone number is 732-5. No, I don't want to give you my cell phone number. That would be a mistake. 732-899-0951. Of course, once I get to know you, I will give you my cell phone number. But I really appreciate the interview, Art. Thank you.
Oh man, no, I really love the information. So I hope you guys enjoyed today's interview. And if you like what you see, please subscribe on the top right button. And also, after watching this podcast, scroll down to the bottom of your screen and download the first chapter of our book, which is called The Retiring Baby Boomer Roadmap. So, buddy, I will be talking with you soon. And it was great to see you again. Thank you for your time. Much appreciated.
Thank you for having.
My pleasure. And thank Melissa for her technical abilities that helped us get along with this.
Very good. I will.
All right, buddy. Take care.
Okay.
Thanks.
Bye-bye.
Bye-bye.